Recording in
order the
progress.
March 27, 2026 Iowa Medical Cannabidiol Board meeting at 10:03 a.m. For those joining us virtually, if you would like to speak during the public comment period, please send an email expressing your interest to medical.cannabis@hhs.iowa.gov. Item 2 on the agenda is the roll call. So when I call your name, please say here. Dr. Richards,
Here.
Dr. Schreck,
Here.
Dr. Weber,
Here.
Dr. Mokadev,
Here.
Dr. Garvin,
Here.
and Nurse Practitioner Brown.
Here.
All right, everyone's in attendance. Thank you. Item 3, the approval of minutes. It is now time to approve the minutes from the November 14, 2025 Medical Board meeting. Has everyone had a chance to review these minutes, and are there any questions or edits to the minutes? Okay, hearing none, I would like to entertain a motion to approve these minutes.
So move, Shrek.
Do we have a second?
Second, Garvin.
Okay. Motion and second. Is there any further discussion? Okay, hearing none. All those in favor, please say aye.
Aye.
Aye. Any opposed, say nay. Thank you. The motion carries. Item 4 is the public comment period. We've set aside this time to allow any members of the public who would like to address the board. All speakers are asked to keep their comments to 3 minutes. If you've not previously registered or did not do so during the call to order, please do so now with the instructions provided. You will be called upon individually when it is your opportunity to speak. We will do our commenters here kind of moderated by Andrea, Katie, so I'll turn it over to you guys.
Our first public commenter is Carl Olson. Give me one moment to promote you. All right, you should be able to unmute.
All right. Can you hear me?
Yes.
You
All
got you,
right.
Carl.
Yeah, well, I want to thank the board for continuing to support an application for federal authorization under 21 USC 822D. The Attorney General of the United States can waive registration requirements, and so theoretically, if you read that, it would cover the whole entire Iowa program. Manufacturers, distributors, and users particularly would become legal. No guarantee it would be granted, but not applying for it is insane. So the board has been helping me with that, recommending that every single year. I'm in the process of mailing 280 primary candidates for legislation in Iowa, asking them to read the board's recommendation and to support it. So that's it. Have a good day. Thank you.
You yield your time.
Yes, I do. Thank you, Owen.
Thank you. I think, Andrea, we can move on to the next public commenter.
All right. Our next public commenter is Tyson Alchin. I've just promoted you to allow you to speak.
Thank
Do we
you.
have you, Tyson?
Yes, can you hear me?
Yes.
Yep, we got you. You can start when you're ready.
Thank you. I'm going to apologize in advance. This one's very personal, and I'll try to get through it the best I can. On this past Monday, 3/23 at 11:52 p.m., I got the news that my best friend since childhood had passed away. As a board of doctors, you are intimately aware of the potential health problems that can result from a lifetime of alcohol abuse. Ultimately, organ failure due to alcohol abuse is what took my friend. The HHS website provides information on 2020 to 2025 Iowa substance abuse deaths. There were 4,851 in the last 5 years. I don't know what the criteria of the Bureau of Health Statistics include, but I imagine that number could be slightly higher. States with legal medical and recreational cannabis are seeing reduced alcohol-related issues from simple consumption to deaths across the board. Within the last year, I had an opportunity to grow cannabis in Malta. Unfortunately, those plans didn't quite work out due to the education system there. But I met with club owners. The EU club system merits a look, as it is basically a cost share program at heart, local growers providing for local members with no advertising of any kind allowed. Simple word of mouth driven by quality and local demand. I met with Chief Officer Foyt from the Authority for the Responsible Use of Cannabis. He explained how Malta's position on cannabis was that of harm reduction. Cannabis was in Malta and it wasn't going away, so the government stepped in and formed a program with limits and required testing. Quality standards were set that every club grower must meet before their products can go to club members. People can only buy from their club. There are monthly limits, and you can only belong to one club at a time. Again, no advertising of any kind truly makes it a quality-driven market. I lost a friend to a legal drug with laws and restrictions in place. I'm asking this board to consider harm reduction moving forward. Cannabis is in Iowa and it isn't going away. This board plays an important role in how legislation can be formed to take it from one of the most restrictive programs in the US to a leader in harm reduction. Small local providers with quality and quantity standards in place to serve a community that deserves better legal options. Thank you, and I yield any remaining time.
Thank you, Tyson, for sharing your story and participating as always.
The next public commenter is Maggie Ballard. I have just promoted you, Maggie.
Maggie, do we have you?
You do. You hear me?
Yep. You're welcome to
Okay,
start.
perfect. Thank you. So today I just wanted to express my appreciation for the program that we have in Iowa. In talking to legislators this year, they've had a record number of bills that they have to work through. And I think one of the concerns that they're facing is stuff with a lot of other substances. And so for right now, knock on wood, it seems like the recommendations of this board have been have been used and adopted. I know that there was the one introduced to increase the number of dispensaries from 5 to 10. But as far as recommending or as far as looking at the smokable flower, I know that the board has done a really great job of following the science on that. I'm probably not the first person to talk about the article that came out by actually CNN earlier this week. It might have been last week, but it just talked about the mental health conditions that do not improve from marijuana use. I thought that was really interesting. I also have heard about the bill that was passed by one of our houses in Iowa to allow for psychedelic or psilocybin mushrooms for the use for PTSD. And one of the things in that bill would also pass along that responsibility of kind of monitoring that to this board. And so I look forward to hearing your comments or concerns about that. And I understand that it might be strictly hypothetical at this point if nothing more happens with that bill. But I do ask the board to exercise caution about taking on a whole nother substance and having to become the board that kind of monitors or makes recommendations for any non-FDA approved drug or medicine for Iowa. I think that's it's kind of a slippery slope of how much more the board would have to take on. So with that, I will yield the rest of my time if I have any.
Sounds good. Thank you, Maggie.
Thank you, Maggie. Our next public commenter is Steve Poisel. I have just promoted you, Steve.
Thank you. Can you hear me?
Yes.
Yep. We have you, Steve.
Okay.
You can start when you'd like.
Thank you. This is a brief verbal testimony provided for the inclusion in this meeting. I also included a written detailed statement that I mailed to the email provided. I'm testifying to share the significant medical and personal impact of Iowa's current restrictions on raw cannabis flower. As a Vietnam era veteran and a primary caregiver for my wife, I have witnessed firsthand the prohibition of smoked vaporized leaf and then directly led to a decline in our health and financial stability following my 2024 arrest and 2025 conviction. Since adhering to the court's mandate and ceasing the use of vaporized leaf cannabis, we have experienced the following. I have severe weight loss. I've lost 34 pounds, bringing my weight below my 1972 enlistment weight when I joined the Navy. And my wife has lost 60 pounds due to a total loss of appetite. My health has deteriorated to the point of requiring iron and plasma IV infusions. We have been forced to return back to medications with significant side effects to manage pain and that was previously controlled by cannabis. The legal and fines have eroded our retirement savings to the tune of approximately $26,000. While the Medical Cannabinoid Board has previously reviewed vaporized flower, including a November 2025 subcommittee report that did not recommend its addition due to concerns over diversion and long-term safety data, I urge the board to reconsider these findings in light of our medical necessity experienced by several disabled veterans and chronic pain patients. Neighboring states like Missouri have demonstrated that a regulated raw cannabis market can successfully fund critical public services. Missouri's program reportedly generated $1.5 billion in revenue in this past 24-25 fiscal year, with funds supporting veterans' health care, public defenders, and substance abuse treatment. I ask the board to recommend that the Iowa General Assembly amend the definition of medical cannabinoid to include vaporized raw cannabis flower. This would allow Iowans to access a more affordable and effective treatment option while remaining compliant with state law. Respectfully, a Navy veteran and an Iowa medical cannabis holder since 2018. I also, like I said, included a much larger and longer statement which had provided more detail than my testimony. I released the balance of my time.
Thank you, Steve.
Our last public commenter is Mary Layden Molds, who I am not seeing on our list. Mary, if you're here, could you raise your hand on Zoom or otherwise identify yourself? Mary Layden Molds, last call. If you could identify yourself on Zoom by raising your hand or otherwise.
And if not, we can always contact Mary afterwards and she can provide a written comment for the minutes.
All right, that was our last public commenter.
All right. Thank you, everyone, for your information and opinions. We do appreciate you sharing that with us today. Item 5 on the agenda is the 2026 Bureau and Legislative Updates from HHS. So as we begin 2026, Owen will provide us an update on federal and state legislative happenings. The Bureau and legislative updates will be combined in his presentation. The board is welcome to ask questions at any time. Thank you, Owen.
Thank you, Captain McKelvey. All right, everybody. So let me see here. Make sure I got my. Alrighty, so can everybody see my screen here?
Yes, we can.
Alrighty. Yeah. So we'll get started here, and I am handling this a little bit differently. I know that people are used to some data updates, quarter by quarter. But I think seeing the last 3 years and a lot of these numbers being maintained, I think that that's still the case. So in lieu of that, I decided to, if people, again, I'll back up a little bit. If you recall our November meeting, right around that time, even I believe the day or so prior, there was the legislation to reopen the government that had impacts to consumable hemp. And just again, I think at this point, as it relates to our bureau managing both programs, I will give an update there. And then a few weeks after our meeting, there was the executive order by the president that related to rescheduling, but also kind of this CMS pilot study for consumable hemp products. So there's been some updated information on that too that I'll provide. And then I'll cover some of the legislative activity that happened in the session this year. I think some people did mention, right, there's been a lot of other activity in the session, so maybe some less activity on the cannabis side that we've seen. So we'll start with some of that federal activity. And if people recall again, that was to reopen the government, and there were some pretty consequential things included in that related to consumable hemp. So I will kind of give an overview on, really what that was about. So people with the current consumable hemp, legislation and going back to the Farm Bill, right, there was a conflation of, those THC amounts that were intended for the field, and then kind of the lack of foresight of how that may relate to the downstream products, which did lead to a lot of the expansion of that industry that we've seen. So really that legislation looked to address that conflation and clearly separate the field from the downstream products. And really what that did, or the THC limits included in that, limited it to 0.4 milligrams of THC per container. And right, obviously that is much more restrictive than the legislation that we had passed in 2024, which limits it to 4 milligrams per serving and 10 milligrams per container. Another item included in that, right, was the prohibition of synthetic cannabinoids. This is the Delta 8, the Delta 10, some of those, cannabinoids where there's even less, right, health and safety or information data than even there is for THC or CBD. So Iowa, again, with that legislation already conformed to that, but that would be included come November. It also required within 90 days of the act for the FDA to publish some rules, right? Like a list of cannabinoids that are, intoxicating, specific information on the container. But that date has come and passed without any action. I think in some respects, we did expect that. And then also the big thing, right? These changes become effective 1 year from enactment. So that's, November 12th, November 13th of this year. And so again, what are the implications of that? As written, right, it would essentially make a lot of the current industry that we see, illegal overnight. And the big thing is that is in law, and it would require active changes by Congress to change it. So kind of what we're seeing, right, is there's, different states are taking different approaches, but generally it kind of is being reduced to 3 various options. Right? So states can conform to that legislation, just saying that, right, that whatever those federal limits are in the future, our state is going to conform to them, right? So in Iowa's case, we would realistically maintain, all of our regulatory components, The difference being that we would only accept products that meet that 0.4 milligram per container threshold. So right, that would, we do have quite a few products that don't have THC. These are the CBD forward products, a lot of the topicals, some of the tinctures, even some of the edible products, so those would be able to stay, right? But we would not be able to approve anything beyond that for sale. Another option that states are exploring, is, there are states that have seen a wide expansion of those programs in their state. I think of Minnesota as an example. Maybe they try to create a state regulated consumable hemp market, right? So, right, what that does mean is if, these laws don't change and they go into effect, that puts those programs in the same position that the state medical or adult use markets are in right now, right? Where they are in violation of federal law. And then really it depends on how the federal government would choose to enforce that or how their state would choose to enforce that. Another option the states are considering is kind of creating a hybrid, cannabis hemp channel, right, where all of those intoxicating products that are currently on the market would only be allowed through the, regulated cannabis systems. So again, that's a solution states are, considering. But again, that puts it in the same place as cannabis is. Again, where it may be state legal in some form, right? But it is still illegal federally. So that we've been tracking the legislation in various states, but really it kind of comes down to, some of these three options, and, the legislative sessions are still active, and we'll see how some of that shakes out. And again, a lot of it is still, again, predicated on what federal's enforcement or guidance is going to look like, which we still do not know. Maybe the one of the things I will say, right, that for us, as it does as as a bureau, right, that regulates one plant, kind of both programs, right, our operations and revenue are predicated on revenue from both, so we are planning to, again, realistically lose that revenue, so that does have impacts for us, how we think about staffing. We've clawed back some of our proposed work on our IT system that we've discussed. We've pulled back on some of the, maybe some testing methods that we would like to have on the shelf for any future changes, so we wouldn't have to address it at that point. But a lot of that is going to be put on hold, right, where we look at cost containment as much as possible while we wait to see what really happens. So again, what happens next? Again, this language does not have to be negotiated. If there is no federal action, it goes into effect at that November date that I mentioned. Again, the FDA has already missed some of these deadlines for some of this guidance that they were supposed to provide. There have been discussions, and that actually came and went also. There was meetings in the last month on the Farm Bill. I think the industry was hopeful that maybe this would be brought up, but it was not seen as germane and was not discussed. There also have been various, I'll say, delay bills, right, to maybe push out that effective date a couple of years. That did have sponsorship in bills introduced in both chambers at the federal level, a decent amount of sponsors, but we really haven't seen, any activity on that since. And again, I think it's, there's quite a bit happening at the federal level. Again, it takes an act of Congress. I think we know how that's kind of gone generally. So again, it is really unclear and in all likelihood, unlikely, that a standalone bill, given the support that it would take, would be able to pass Congress again in an election year as you stack these things on top of each other, right? So we are still planning for, come what may, right? But then this leads it into, right, states are still going to have to plan. They're still going to have to act one way or another. So, right, we do not know what federal enforcement looks like. I think we obviously all have an idea of what it's looked like on the cannabis side of things, meaning none. So what will happen during this sell down period, right, where you have these brands and these companies that have been rapidly expanding, but how do they act? Do they run up right to the finish line? Do they start to slow down? How do The big players in this space, whether on the alcohol side or on the retail side, start to do this, right? Those are companies that have, pretty strict compliance standards. They have underwriting, insurance that they have to manage, right? So, well, how are they going to look at this as this date draws nearer and they're put in the position of holding potentially millions of dollars of inventory that becomes a Schedule One substance overnight? I think another thing that's very interesting with this is a lot of the consumable hemp space is direct to consumer or online, right? So a lot of these e-commerce platforms, right, like Shopify, that, how do they handle, right, essentially being an enabler, right, or an accomplice to distributing Schedule One substances leading up to that date? How do they handle that? Right? And then I think another interesting thing is that alcohol, we've seen some of those numbers go down, and alcohol has a vested interest, right, and margins and providing a substitute for the losses they've seen on alcohol. How engaged do they become in this and, use their lobbies? But again, I think the thing is I'm trying to communicate to you is there's still a lot unknown. And a lot of the work of our bureau, right, has been analyzing these various options leading up to that date. So another thing that happened a few weeks after our latest board meeting was an executive order by the president that, was kind of saying that he wanted the expedited review or move to Schedule 3. And there's been a lot of confusion, and you still hear a lot of people saying that that is what happened. But to be very clear, there's nothing happened, and it is really no different than what President Biden had done previously, if you recall those conversations we've had for the last few years. So there were a couple other wrinkles in that, right? There was an aspect of, trying to find, maybe a place for some of these more well-intended or full spectrum products. And then again, there was the alluding to this, CMS pilot study, for Medicare and, various other avenues to try and find a kind of a placeholder for those. So again, I want to kind of reiterate again, even if there was rescheduling, what that would do and what it would not do. So kind of related to a bill, that has been a proposed by our board, or a solution proposed to our board is, right, it would remove the applicability of Section 280E from the federal tax code, which would allow, businesses, these licensees in these state regulated markets to, deduct those standard expenses. I think something else obvious, right, is that the board is aware of being able to conduct research or to provide better licenses for companies that actually have representative products to do that research on. I think, again, we're very fortunate that, again, one of our manufacturing licensees is one of the only other, entities to have one of those licenses. Incredibly difficult to get, but it may allow some further opportunity for companies like that. So again, a lot of confusion around this, right? But what it will not do is change the status of these regulated markets as they are, right? They're still violating federal law. It would not allow these products to be prescribed by physicians for any medical conditions. It would not legalize interstate commerce. And it would still, really not allow for the use of those, kind of real world products, because again, those would still have to be FDA approved, go through the standard channels that you're aware of. It would not change some of the, again, that FinCEN or some of that financial guidance, even though it does, solve some of that 280E issues. And then it doesn't change any of, right, the drug testing components that people may want to maintain, or any of the criminal penalties related to it. So again, I think when considering how the media is and how these things get portrayed within it, it's just very important to say, again, even if this were to happen, which again, it is potentially one of the most bureaucratic processes that exist. I obviously don't know all those, but I know this is incredibly difficult to unwind. So I just wanted to kind of start with that on what it will and will not do. So I think the other thing is there has been some very recent guidance that's come out on this CMS pilot study. So what would it do? I mean, a very aggressive date, April 1st, for this pilot program to reimburse up to $500 per year, for these, substances deemed appropriate for Medicare participants. So these beneficiaries would have to be over 18, could not have any of the disqualifying conditions, must not be pregnant or breastfeeding, and not meet this frailty exclusion, right? I think there's still, again, some of this solicits more questions than answers, but at least this is a little bit more than just a line in an executive order. So what products would be included? Those are eligible hemp products must, be less than that 0.3% THC, less than 3 milligrams of any THC per container, right? But you can see how that's very quickly going to run aground of the 0.4, per container that is going into effect there. So they would have to find a solution or a carve out or something totally specific to even allow for those products. Inhalable products would be prohibited. These products have to comply with state and federal law. Don't know what that means. Eligible hemp products must be furnished provided by a qualifying physician affiliated with this model. Don't know what that means. And eligible products must be tested by a third party for potency, contaminants, hazards. And again, it is not clear what that would look like or who's going to be doing it, who would be overseeing it. So this gives us a little information, but not near enough to actually be able to do much with it. I will say, even as of today, I think even this morning, there has been, kind of some meetings scheduled about this leading up to the April 1st date. There's also been letters sent to the Attorney General, from the DEA and Congress to provide some further guidance on the rescheduling issue. So again, we see activity, maybe a little bit of guidance, not near enough, people wanting more information. So I think in some regards, the theme of this year is going to be, updating you on how these various things go leading up to some of the effective dates that have been outlined for us. So maybe just what are some takeaways? Again, I've kind of outlined some of that, right? But it does read, right, like a limited pilot federal medical cannabis program for hemp products with 3 milligrams of THC or less per serving. Again, that they're going to have to solve for that broad spectrum product issue, which I think, maybe we on our side, maybe we're a little more uniquely qualified to understand that. Because going back to the 2024 legislation, right, we tried to solve for the per serving, per container limits that where there were none, trying to, capture products with, orders of magnitude more THC than are allowed in adult use programs. But we did know that that was going to cause some of an issue with the broad spectrum products that are well intended, right, but do have quite a bit of THC per container. But even though the THC per serving is intended to be very limited in a pipette, right, and it's difficult to find a creative solution to accommodate all of it, considering how the sausage is made with legislation. So again, I have more questions and answers. What will compliance and enforcement look like, and who will be in charge of that? Who will be reviewing these testing standards and compliance overall? Is it supposed to be some of these accountable care organizations that are cited? Who's going to oversee the clinician disbursement of these products? How are they going to get involved? And again, how will the oversight of the testing framework work? What are the thresholds? What are the contaminants? Who's going to be testing them? So again, I think this is very recent information, but in the regulatory sphere, right, more questions than answers. So, maybe I guess just before I go into some of the state-based items, are there any questions about some of this federal activity that you all have? And
And Bob
if not,
Schreck,
yeah,
I just read about this week, and as I read it, it looked like it was aiming that the effector organ would be, or effector organization would be the accountable care organizations, the several
yeah,
dozens or hundreds of them around the country.
Yep.
Do we even have one of those in Iowa?
To be honest with you, actually, that's outside of my
Okay. Does
knowledge sphere. I would
anybody
have
else, other
to, I mean, I
doctor, know
think
of
that's,
of
yeah,
an ACO in Iowa? Any other doctors on the panel know of one? I mean, the Accountable Care Organization is one that takes on, um, basically um, responsibility not only for the quality of care, but the financial aspects of that care. And
Bob, Steve Richards, the answer is yes, there are. Okay. Uh, how strong they are right now, I don't know, but there was a real push a while back to get them created, and I believe there's some that still exist right now.
right, there's this Oak Park facility here in Des Moines, which I've just come across, and based upon how it seems to operate and how it fits into other programs, it may be one. But obviously, it is not a widespread impact. It would just be the providers in those organizations that would be able to hand out these medications.
There was a physician,
Again,
Don Klitgard out of Harlan, which was pushing it in the rural area. Now, unfortunately, Don got colon cancer and has passed away, so I haven't kept up with where it got after that. There's a guy down in Winterset, and he's on the Medicaid P&T committee who might be able to answer that for us. And right now, his name is skipping me. I can see his face, but can't remember his name.
well, we'll see. I mean, if it even comes to pass, we'll see. We'll find out, obviously. Thank you.
And Parker, just to be clear, the language used the term physician, not provider, not prescriber, not
correct.
even clinician. Okay.
Yep. 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 So, I mean, again, this is never,
Yep.
It's interesting that maybe a pilot for a, right? We know there's other federal programs out there, right? But it's interesting that this is a little bit of the form that it's kind of taking if you interpret it that way.
We another comment on the hemp program. I'm sure you're aware that we had an organization here in Des Moines we're operating under the name Dispensary, spelled DES Dispensary. Had two outlets here in Des Moines. They had one on Court Avenue, which closed down, I believe, last year. One on Ingersoll, which is right next to our favorite restaurant. So I was able to observe its actions and availability in the evenings. I never, in the entire time it was open, saw anyone in that building except the one or two people working there. And they closed earlier this month. So that's disappeared. The space is now for rent. Obviously, in response to state, if not federal, actions on this in this regard. So it's having an obvious impact right here in Iowa.
I just
Dr.
have like
Murphy?
one, sorry, I just have one comment slash confusion about like, this whole sequential of laws and regulations, specifically like the new edition of the hemp concentration regulation of the 0.4 and stuff, since the federal has been pretty much, as Owen mentioned, has not been chasing any further action regarding the actual cannabis, like regulated by state laws, which have been, pretty much like broken the federal limits and legislations, and there is no big actions there. And there's a December 2025, change of rescheduling the level of the cannabis. It's anywhere from 1 to 3. And yet still, despite no actions from the federal regarding the other states that legalize it, they go after the hemp, and they change there is a change in this regulation. While we've seen what happened with the bigger, the mother umbrella. So I'm a bit confused more in terms of like, what does this even mean and why we're chasing a tail here? I don't know. It's just me maybe.
No, it's a fair assessment, Dr. Mokadam, and I think that's why, right, we as states, right, I was, again, I was somewhat unique, right, where we not only have a dedicated regulatory authority, we've passed legislation to clean it up, so to speak. So, I mean, I think we are preparing to, in similar to cannabis, we are probably going to be the de facto people.
I can see that. Yeah.
Yeah. So, and without anything further, right, which we'll be watching, I think we're planning to one way or another be responsible for that in some regard, I think. And again, I think Iowa may be more better positioned, with there's other states in that bucket too. But, we should remember that there are some states on the hemp side that still have no regulatory authority that's in charge of regulating it, no restrictions on, right, the age limits, the potency. A lot of this stuff is still, just as,
Have the
free
longer
game.
roads to kind of take. Yeah, yeah.
Yeah. Yeah, so
Nothing.
we'll see what happens. So, maybe I'll go into the Iowa legislative activity, that we've seen this year. And again, right, keep in mind, this is the governor's, last session. There's plenty of other priorities. I think it's well documented. There's been a lot of introduction of legislation. We've really had kind of two bills, that we've been watching, and again, as they relate to the board's recommendations. So we have HF 990. So this would allow HHS to license up to 5 additional dispensaries. I think it's important that it doesn't mandate that we do. I think we do know in some respects the fragile economics of the program that we have, and the operators that we currently have. And so even if that were to pass, I'm not sure how much of a rush we would be in to do that. One of the other things that was combined with this bill that has been introduced in the last few years was to allow HHS to, issue, not insure, registration cards to non-residents. So the scenario for this would be, let's say there's residents in Omaha, right, who are near the Council Bluffs dispensary, would allow them to get a card to come and purchase in our dispensaries, and then return back to Omaha, Nebraska. Even though Nebraska is, in the process of implementing a medical cannabis program, right, there's still that state line issue and all those types of things, right? So we'll see about that. I mean, I will say that this passed the House in 2025. It was, brought back up in the Senate this year, has passed subcommittee, and committee. And so really it's just kind of waiting to see if it gets a floor vote, what that floor vote looks like. And we've kind of seen in the last week that it's been put on the calendar, not discussed, put on the calendar, not discussed. So we will see what happened with that. It's just currently listed under unfinished business right now. The other bill that relates to a board recommendation, right, but this is more on the Department of Revenue side, would allow for that, state-based deductions for licenses and, licensed manufacturers, dispensaries, again, typo there, to decouple our tax code so that at least on the state side, right, they could have a reduction in burden of their taxes. This did pass a subcommittee in the House, but with no further action, right, it got funneled and is not moving forward. Again, there's always ways that things can be a zombie, so to speak, and come back in one form or another or combined with something. But this is the way that we are looking at it now. So one of the other big things, and again, just as it relates to this board, relates to HHS responsibilities, is that bill for the medical psilocybin program. This was HF 978. And so kind of what happened with this bill, right? It started out in this more simplified form, right? Where there was a cap at 5,000 patients. It was limited to PTSD. I think even upon introduction was limited to veterans. But as it made its way through the House last session, or not even on its way to the House, there was floor amendments, I believe, that kind of significantly expanded it. It allowed for physician discretion of any condition, removed the limit on the number of manufacturers, and this bill was revived in the Senate this year, kind of with the intention of providing amendments to bring it back down to that original limited program that it was introduced as in the House. So really what it would do is you can kind of see that it is modeled in some respects after the, kind of the rigor and compliance requirements of the medical cannabis program with obviously some key differences. But one of the big things, right, is it would combine, there's a board listed in the original bill that has been combined with the medical cannabidiol board. It reduces the members. So this board and a couple of new members would be involved in some of the stand-up of that program, similar to how the board was, pretty invested at the beginning of the program. Again, it would limit it to PTSD with a maximum of 5,000 patients. It would license cultivators and testing labs. And while there's no maximum, I think it's kind of a point of clarification for the board is that the supply chain and operations of something like this would be much different than cannabis, right? Where cannabis is something that there's a rolling purchase cycle. I think we see that, right? Where patients may purchase a couple times a month. This would be different, right? Where patients may only need one treatment or a couple treatments once a year, once a year, if ever, right? So there's just much less of a need for the production side of things. And in all reality, even if this were to pass, it could probably be sustained by one licensee on the cultivation side. You're talking, cannabis is very energy intensive. Some of the difficulty and cost is related to extraction, right, of a fat soluble molecule. It takes different solvents. Psilocybin is water soluble. So even if there were downstream products from the mushrooms, right, much easier to work with. So you're talking like a small room with tiered racks could probably sustain this market. One of the other key differences, right, is there are qualified medical psilocybin providers, right, who are the recommenders of these, their patients for this type of treatment. CME is required. There are a few other, so let's say that I were to pass this, we would be the fourth program in the country. There's Oregon, Colorado, and New Mexico who have versions of programs like this. So we would probably get the CME from them or, something similar. No, would be no reason to reinvent the wheel there. And then this is separate from the qualified therapy providers, right? Who would be the administrators of the product to the patients in kind of a guided therapy scenario that also requires a CME. And those who can actually administer the product is slightly expanded from those who can recommend. So it'd be, that standard list of physicians, PAs, ARNPs, but then also psychologists or social workers. And kind of one other key difference, right, is with cannabis, right, they're going to a dispensary to purchase the product and then they can take it home, right? So there's an affirmative defense that needs to be provided. But in this case, you're not really licensing. There are facility requirements, compliance requirements for the facilities that might be administering the product, but the product is only, right, it stays at the facility. It isn't like you go there and you purchase product and then you get to leave and do this yourself. It's only in that guided therapy session. And I will say maybe there's, in terms of access points, right, as on medical cannabis, there's only 5. This by only licensing the actual administerer of the product, right, there would be more points of access for people to receive the treatment, right? It's predicated on, do you have the, our certification to administer the product? There are other safety things that are called out, right? There's similar inventory tracking, right, for the core product, the waste, the harvested product, transfers, the inventory that would be within these facilities that it's being administered. There's also, registration cards and registries, verification systems, similar to medical cannabis too, where the stakeholders, right, doesn't matter if it's the cultivators and their agents, the testing labs and their agents, the recommenders and their agents, and the actual, again, administrators and their agents would all have to be kind of registered in this system. So again, analogous to how medical cannabis operates here, but with some key differences. So I kind of also already, started with the activity that we've seen around it. But at this point, right, there was a lot of activity, a good amount of engagement, but I think at this point, it's been referred to Ways and Means. So we're just going to see what happens with it. So really with that, that kind of concludes my updates. So if there's any questions that the board has on any of this, I'd be happy to answer them.
So
Oh,
this,
and Bob,
sorry, the
sorry.
psilocybin bill has just is in effect right now. It's not yet in effect.
No, it's so really it would be at some of the last stages. Right? It's passed all the necessary hurdles. It's just up to kind of leaders of the Senate to determine if it were to get a floor vote, and then right, it would require the governor's signature from there.
I see.
Oh, and Bob Schreck, as I read the bill, I read it twice. Um, as I read it, it looks like it adds 4 members to the
Yeah,
board,
they
but
did in the amendment. Yeah, where it would limit, it would add 4. I think there's been other discussions about further limiting that to just 2. Right, and we'd have to determine what those members were to look like. I think simpler the better there. Right, as we've learned, there's vacancies that we have never been able to or are difficult to fill, right, as it relates to the topic and the specialty and the subject matter. So, right, it would be preferable if, there was members of the public, right, that had knowledge, right, of psilocybin, or, people that maybe specialize in the nutraceutical space. But I think if we were to get more specific with some of the other, qualifications that are listed, particularly in Iowa, those 4 obvious reasons might be difficult to find. So I think in some ways, right, simpler the better with those qualifications.
if passed as it's currently worded, those 4 individuals would be, if you haven't read it, they're required to have knowledge in the production and of chemistry of psilocybin, have to have knowledge, as you said, in pharmaceuticals, phytopharmaceuticals. Where would those people come from? I suppose they could come from academia. I mean,
Yeah.
I'm not sure where or who they'd be, but they would certainly come from industry. And it would change the character of this board, or would influence the character of this board. Right now, we have no representative of industry on this board. We have representative of licensed physicians, nurse practitioners, and pharmacists, but no representative of manufacturing industry. I'm sure the manufacturers would come up with people qualified to fill these positions, and they would then represent the interests of industry as well. So as we think about the board the board we've had now for the better part of a decade, this would change the character, not overturn the character, but influence the character of the board going forward. That's I'm not putting that up as an objection, but I think it's an observation we all need to be aware of.
Yeah, I mean, I certainly understand that, Dr. Schreck, and keep in mind, right, that while these board, the medical cannabis board is governor appointed, these are also appointments. I think it's written they're chosen by the HHS director, right, but in a pool of applicants, right, there would be, right, these types of things, right, would be at play similarly. So I think you can see with the consolidation in the boards and commissions, you know what I mean, and not trying to limit the numbers of boards. I think that's kind of where this thesis for combining it comes from. But obviously, right, there would be, caution and discretion used with how anyone would be appointed if this were to become reality. So. Are there any other questions that the board has on any of this? Seeing none, appreciate you all listening to that. And, right, again, I think a theme of this year will be kind of updating you on information about all of this, as it comes out. I think that's, different. Again, speaking to the board being together for the better part of a decade, right? I think that's something we're not used to, is waiting for guidance or action or discussions at the federal level. So we'll see what happens.
Oh, and I'm going to say something. When there aren't a lot of questions from the board, it usually means your report's pretty good. Okay, and then it's covered the items the way they need to be covered. So you should be congratulated for doing that.
No, I appreciate that, Dr. Richards. Yeah, I mean, we've been doing this a while now. Again, I think we very plugged into the regulatory community, and right, I think information flows much better now. So I think it's probably more of a kudos to the regulatory community. Now we've all had to come together, right, in the absence of federal guidance, but I appreciate it. I think Chief McKelvey, I will hand it over to you if there's no further questions.
Okay. Item 6 on the agenda is about board vacancies. Owen will provide us a brief update on those. Thank you, Owen.
Yeah. And there's still, haven't seen, I kind of mentioned that, the talent bank in the process for some of this has been updated. Have not heard about any new people, submitting applications. So I think, right, I think we do great with quorum that we haven't, had before, very, knowledgeable and a lot of tenureship on the board. So we haven't done explicit recruitment or anything like that. But there's still those 2 remaining vacancies. So I believe it's pediatrics and neurology, correct? Chief McKelvey, is that what it says? So still, if you have any colleagues in those specialties, please let them know that we're still looking for members.
I could tell you I've tried a couple of times, but I meet a dead end.
Yeah.
Okay, there's not a lot of interest.
That's my experience as well. And maybe that's just because we're not high profile and we're not causing a lot of problems. Maybe we're just doing a good job. And so there's no difficulties. Did we,
Sounds good. I think that's all I have for that, Chief McKelvey.
All right. Item 7 are about our future board meetings for 2026. Currently, they're slated to occur on Friday, July 24 and Friday, November 6. The public will be notified of any changes, and we welcome the public's participation as always. Owen, are you ready to move to item 8?
Yes.
All right. Item 8 comes down to adjournment. We're at the end of our agenda. Are there any further comments from any of our board members?
I have one. Congratulations, Chief McKelvey, on your promotion up in the Sarasota area. You may see that he's no longer Captain McKelvey. He's Chief of Police up there. So congratulations to you, and I'll be sure to clean that up in
Congrats.
the minutes and going forward.
Sorry, don't worry about it. I've been called a lot of things, so don't worry about it. But thank you. If there's nothing else, I'd like to entertain a motion to adjourn this meeting.
So moved.
Okay, how about a second?
Second.
All right, we have a motion and a second. All in favor, please say aye.
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 Any opposed, say nay. All right, thank you, everyone. The motion carries. The meeting is officially adjourned at 11:01 a.m. Thank you.
Thank you, everybody, and from the public for participating as always. And we'll see you in 3 to 4 months. Thank you, everybody.